Hi, I'm Dr. Karen Parmar. My husband, Dr. Parmar, and myself started Integrated Health Clinic in the fall of 2000. I have been in practice for the past 18 years, always with a focus on pregnancy. This includes mainly three different types of women. The first being women who are wanting to get pregnant and are having difficulty with that process, either primary infertility or secondary infertility, or they can get pregnant but they can't hold it, having miscarriages or recurrent miscarriages. So I see a lot of those patients, and I have a 6-phased approach that I have put together that's on our website that you could go and visit, that talks about that process from the very beginning all the way up to ovulation induction and intrauterine inseminations, if that's a good fit. The second group of women are women who are already pregnant, and they're just wanting naturopathic support for the healthiest pregnancy for them and for their baby. This is a really comfortable area for me. I've had 4 healthy children, luckily, myself, all home births. I feel like I have a lot of personal experience in that area. And again, 18 years clinical experience. Group number 3 are ladies who are not ready for that, and they're not wanting to get pregnant, and they're wanting a really solid birth control option. And for those women, I do IUD insertions. I do both copper, I do hormonal, I do IUD insertions for teens, for women who have never had sex or just getting married, and for women who are sexually active, 20s, 30s, 40s. I do a bit of a unique insertion model. I do an ultrasound beforehand to make sure I know where the uterus is, and then I do freezing of the cervix to make it as least painful as possible, and then an ultrasound at the end to make sure that the IUD is where it needs to be. So my practice is all about pregnancy. You want to be pregnant, you don't want to be pregnant. That's kind of what I do. Something unique that I bring to Integrated Health Clinic would be the bedside sonography. I use ultrasound in my practice a lot. I use it in my fertility practice to monitor egg development, make sure that we have a good number of eggs, a strong ovulation, and that there's adequate lining for implantation to occur. So I do that a lot, and probably monthly with some women who are trying to get pregnant. I also will use it a lot in my IUD practice. Like I said before, you don't know where you're going with an IUD. I don't think it's great to put one in if you can't confirm that you've got it in the right place. So I do it a lot in my IUD practice. Monthly, we do checks afterwards and make sure it's where it needs to be. And then I see patients in the clinic who just want to have a PAP and who want to have STD testing, or docs are referring patients to me for ultrasound, monitoring polycystic ovaries, monitoring endometrial linings for patients that are on hormones. So I do have a lot of in-clinic referrals that come to me for specific gynae questions and discoveries that need to happen. If you want some more information, you can go to our website, integratedhealthclinic.com. There's a good write-up on the fertility program that I offer, also offered by a few other doctors at the clinic who treat fertility, and a lot of information on IUDs. That is there, questions that can be answered that could help direct you on a path that's good for you.